Can you hear me?
Yes,
Hello.
we can hear you.
We can hear you.
Yeah, I'm sorry. I wasn't able to get on before, so I don't know what's going on with my system. I've been trying since 6:25. So if you've already started, Edward, I will listen in and chime in.
No, Laquita, we were all the same. I think the office had the controls to start the meeting and then allow all of us to come in at the same time.
Ah, okay.
We're just getting here with you.
Oh, okay then. So I think, let me just check one other thing. It's
So,
recording. You have it on.
I need
Yeah.
to have some power so I can be
Oh,
sharing.
I can make you a co-host.
Cool.
There you are, your co-host.
Sounds good. So
Uh,
I'll share the agenda, Laquita, as you speak.
That will be terrific. Okay. So, hello everyone. Good evening. May Day. So, let me just call the meet. Oh, are all of our other committee members here? Do we have a quorum? Let me see.
Oh, so
We may not. Oh, Patricia's here. Hi, Patricia. I'm here. You're here. That's three of us. Monique is excused,
yes.
and it would be great to have one other person, Heather or Monica, but otherwise we do have a quorum. Three of the five.
So good evening, everyone. And those of you who are joining us for the first time, thank you for joining us. And those who are coming back, thank you for coming back. This is the Health and Environmental Committee for Community Board 9. Here we tackle issues related to health and environment. And these issues are very broad. It goes all the way from noise pollution to car pollution to dealing with issues in our local hospitals. So if you think if you're dealing with something related to health, you want to bring something to the community, this is a great platform where we can listen to what you have to say and then bring it to the broader community board, and then it can be further disseminated to the entire Community Board 9. So I'm a co-chair, Edwin Torres, Dr. Edwin Torres, and Ms. Laquita Henry is also the co-chair for the Health and Environmental Committee.
And what I would like to do at this time, everyone has a copy of the agenda. And so Edwin, I'd like to ask for a motion to adopt the agenda. Unless, is there anyone who has anything to add to our agenda?
Do we have someone from DEP here?
Yeah, that would be added if that person is here. We can, I guess, add them under new business or so if they come.
Okay, we're waiting for them, but that's fine.
Okay, so of the three of us here, including Patricia,
And Heather just joined us.
Who did? Oh, Heather just
Heather.
joined us. Okay, so I want to move to a motion to adopt the agenda.
I motion it.
I'll second.
Okay. All in favor, all four of us? I'm in favor. Okay, it has been moved and adopted the current agenda.
And can I say something real quick, Laquita?
Sure.
If any of you want to be an active participant of this committee, you can join as a public member and help us with some of the efforts that we're taking in the community. So even if you're not in the community board, this is a great way for you to get some exposure of what is it that we do in the community board, and help us perhaps with an issue that you are dear and passionate about that can help us better serve Community Board 9.
Yes, thanks, Edwin, for mentioning that. Um, we need to get to approve the minutes from both the March and April board meetings. They got emailed, well, actually the March minutes got emailed before, but we didn't have a chance to review them before. So both the March and April minutes are here. And let me just add, as always, Patricia Ramos does a beautiful job with our minutes. And I want to thank her publicly again. Meanwhile, if you've had a chance to read them, or review them quickly, can I have a motion to accept adopt the minutes as presented? Or with corrections? Is there anyone, or have you had a chance, have the board members, committee members had a chance to read them? We could come back, we can revisit this during the course of this week, actually. I'll do an email just to make sure.
I have it uploaded if any of the board members wants to have any question.
That's just one of them, right? That's the April.
That's the April.
The April. Why don't we, if
You want to table it?
Yeah, we can table it, and then I can come back. We can do an email since it's only 5 or 6 of us, and
Okay.
just come back to and add it into the minutes.
Okay.
Mhm. So moving forward, let me just say also, the Senior Resource Fair sponsored by the Seniors Committee takes place tomorrow. So I know everyone on the board has gotten the packet. And so among our members, I know our committee is very active, but if there's a way that you can volunteer or assist or just show up, if you can find some time out of your schedule, just check the flyer that was sent, or if you need it to be resent, just put it in the chat and we'll do that. We can post it there. But that's taking place tomorrow. Also tomorrow evening is the Housing and Land Use Committee, where BRC, which is another agency vying to reconstruct the 1727 Amsterdam Avenue. They will be revisiting that committee. It involves displacement of health facilities. And so our committee is actively interested in what's happening there, and it will be an opportunity again to have input. So that's what the Housing and Land Use Committee, if there's an interest, we can put that information in the chat as well.
Laquita, I think that meeting is next Tuesday, the 9th.
Oh, great.
For
Okay,
Housing, Land Use and Zoning.
Thanks, Heather. Thank you. Okay, so they're the second Tuesday of each month. Okay. Thank you. So we could put that information in the chat. Heather, if you have it handy and can do that, that would be great at some point, during the course of our meeting.
I would encourage you all to, if you're not aware of what is happening, take some time to learn about what's going to happen in that site of 145th, where we have an active healthcare facility and what it will become. This is what I call one of those transformational projects right in the heart of Community Board 9 that can have a huge impact. So if you're not aware, this is a good opportunity. Attend the meeting. We have had several here. So please follow up. If you have any questions, you can always send us an email and we'll send you whatever information we have. But here we have an opportunity to pivot the future of what CB9 will look like with this big project. And it takes a community. They need our input, because this is how we get projects. And then people are like, whoa, I didn't hear about this. How did this happen?
Thank you. Absolutely. Thanks, Edwin. So if we can move forward now, we are very pleased to have the Columbia University Herbert Irving Comprehensive Care Cancer Center here again, discussing clinical trials and services offered to the community. They did a wonderful awareness information presentation at our April meeting, and we are encouraging them to come back each month that there's information to be delivered to us. This is again how we learn and we can help members of our community. So we have Brianne Bolden, who's an oncology research nurse manager here. And Brianne, if you need to be made a co-host, I can do that. And I would like for you to introduce Dr. Crew. Let me
Sure. I don't need to be made a co-host, but Dr. Crew may need to be. Before I introduce Dr. Crew, if I could I had one other thing I wanted to share really quickly. We have an event coming up it's May 18th. It's open to the community. Everyone is welcome to attend. And it is about diversity, equity, and inclusion in clinical trials. So it is an in-person event. If anyone is interested, we would, love to extend the invitation, love to have you there. So I will share that information in the chat.
Okay. Is there is it a flyer also that you'll
Yes.
have available? Okay, fantastic.
Yes.
We can get that to the entire board.
Yeah, that would be great because we'd love to see you there. Love to get to see you in person.
Thank you,
So
Brianne.
Dr. Crew is one of our breast oncologists at Columbia, and she has some information she'd like to share today. I'll let her take it from here. Dr. Crew, do you have slides to present?
Yes, I just have a few
Okay, great.
slides. Let me see if I could share them. Can you guys see that okay and hear me okay?
Yes, we can hear you.
Perfect. So as Brianne mentioned, I'm a medical oncologist here at Columbia, and one of my main research interests is actually in preventing breast cancer. So I'm just going to highlight a couple of projects that we've been working on focused on personalized medicine in breast cancer risk assessment and screening. So the first project I'm going to talk about focuses on genetic testing for breast cancer genes so we can raise awareness in unaffected women in the primary care setting. The second project involves artificial intelligence, which has gotten a lot of press recently, and we're using it to improve breast cancer risk assessment in racially and ethnically diverse women in our community. And the last project I'm going to mention may be a trial that will be opening later this year, which is evaluating novel multi-cancer detection blood tests for early detection of multiple cancers. So first, with the genetic testing project, we know that about 5 to 10% of all breast cancers are due to inherited genes that run in the family. The most common are BRCA1 and BRCA2. And it's important to identify these women because we know that they can benefit from enhanced breast cancer screening, as well as risk-reducing surgeries and medications such as tamoxifen. So these two genes were developed in they were first identified in the early 1990s, but it was around 2013 when Angelina Jolie disclosed that she was a BRCA1 carrier, and then opted to get double mastectomies, that there was more attention drawn to this genetic testing. And if we looked at all men and women in the general population, about 5 to 10% of them would meet family history criteria to get genetic testing. But currently it's like less than 5% of individuals who are eligible are actually getting tested. And these genes aren't like super rare. The prevalence in the general population is about 1 in 300, 1 in 400. And we know it's similar across all racial and ethnic groups. So what we initially did was, among women who were coming in for screening mammograms at the Avon Breast Imaging here on St. Nicholas, we screened over 3,000 women to assess their family history. and found that about 12% of them met family history criteria for genetic testing. But again, less than 5% of them actually got testing. So I've been collaborating with Dr. Rita Kukofka in the Department of Biomedical Informatics, and we've developed this web-based app, which is available in English and Spanish. It's called Real Risks or Riesgo Real. And basically it provides information for women about their options for genetic testing and what the genetic test results mean. And we hope that this kind of educational tool will help raise awareness and get more individuals tested. So we did a large clinical trial that we just published the results last year. And we enrolled about 190 women from primary care who met family history criteria. We also developed a tool for the clinicians in the primary care setting to also inform them about the option of genetic testing. And this study was done in Washington Heights in our academic center at Columbia. And the main outcome that we were looking at was to see if we could increase genetic counseling and testing uptake within 6 months of participation in this trial. And what we found is that we were able to approximately double the number of women who pursue genetic counseling and testing with up to 2 years of follow-up. Up to 30% of women completed their genetic testing. So this is some encouraging results in terms of just, again, increasing the numbers from like less than 5% to up to 30% actually following through with testing. The second study that I'm working on with Dr. Richard Ha, who's the head of breast radiology at Columbia. So we're seeing AI all over the place, applied to many different things, but he's been using AI to evaluate mammograms so we can better predict which women are more likely to develop breast cancer. So this is what we call a heat map, where on the mammogram images, the red indicates areas that women may be at higher risk for developing breast cancer, whereas the green and the blue indicates a low risk of developing breast cancer in the future. So we looked at the mammograms of over 23,000 women getting screened at Columbia. And sort of the standard breast cancer risk prediction tools take into account clinical information like age and race, ethnicity, family history of breast cancer, whether a woman's had a breast biopsy, and her breast density on the mammogram. And the usual clinical models, usually the prediction, what we call area under the curve, is about 0.6, 0.65. And generally, these models are much better at predicting breast cancer risk in white women compared to other racial ethnic groups where it's the numbers are lower. So if the AUC is higher, it's more accurate at predicting breast cancer, but lower numbers have more inaccurate numbers. But when we used Dr. Ha's AI model on the mammograms, we saw that we were able to significantly get more accurate breast cancer risk assessment in Blacks, Hispanics, and Asian women compared to the standard clinical model. So why this is important is if we can better identify those groups who are more likely to develop breast cancer, then we can offer them more enhanced screening as well as preventative options as well. So the final thing that I wanted to mention is that we know that cancer is super common. The 4 most common cancers here in the US include prostate and breast cancer, as well as lung cancer and colorectal cancer. And for these 4 most common cancers, in addition to cervical cancer, we have well-established cancer screening tests. But for over 70% of cancers that we see here in the US, we don't have available screening tests. And as a result, there's over 600,000 deaths per year due to cancer. So there's a lot of interest right now in these MCED, multi-cancer detection blood tests. So it turns out when a cancer develops, some of the DNA actually gets shed into the bloodstream, and the technology has improved so much that we can potentially detect this circulating tumor DNA. So this Vanguard trial is going to be sponsored by the National Cancer Institute. And if we're awarded, Columbia can be one of 10 to 15 sites who will be enrolling in this study that will include over 24,000 individuals between the ages of 40 to 75 who don't have a personal history of cancer and who are not necessarily at high risk. So we're looking at average risk screening in the general population. And what we'd like to see is whether or not, in addition to getting sort of those 5 standard of care cancer screening tests, whether adding this MCED blood test will actually help to improve the early detection of cancer and also improve survival. So it's estimated that if these blood tests are effective, then we can potentially reduce cancer mortality by up to 25%, thereby preventing over 150,000 cancer deaths per year. So this is just to give you a flavor of some of the research that's going on at Columbia, but a lot of people sort of feel like this new cancer blood test is going to be sort of the big game changer for us in terms of impact on cancer survival. So I'm going to stop there and I'm happy to take any questions.
Anyone who has a question, there is the hand raise button that you could tap on.
Well,
Go ahead,
I
Edwin.
had a question, Dr. Crew. When you showed the graph with different diagnostic criteria for the different races, and the odds ratio and the difference that the AI model was able to increase the chances of finding out these patients that had cancer, was there? I didn't see a p-value there, because I look at the Hispanic and it moved very, very subtly.
Right. So it turns out that it depends on the numbers. So in our screening population in Washington Heights, we have it was like 70% of the women who were Hispanic. So because we have larger numbers, we have more precise estimates for Hispanic women, but the p-values were significant for the Black and the Hispanic women.
Okay, thank you. And for those who are not in the statistical world, what that means is that when you do a study, there is a statistical analysis that you do that show you that indeed what you were trying to measure was accurate. But thank you. This is very informative. We hope that in the future, any other findings that you guys have in regards to our community, it can be disseminated, because a lot of times, a lot of data is collected, but it doesn't get back into the folks who are the subjects, and people want to learn about this. So anybody has any questions?
Let me just ask Dr. Crew, if I have the number correct, 23,000 or 26,000 were participated in this trial?
So the last trial that I was talking about, the one for the cancer detection blood test. So that trial hasn't opened yet. There was a call to get multiple centers throughout the country to participate, and Columbia threw our hat in the ring. So if we are selected as a site, then we'll be opening the study later this year.
I was just going to ask if that part of the trial was completed, are all of them expected to, just continue throughout the trials?
Yeah, so the study will be open for about 4 years, and we're going to look for participants, a diverse community, because we want to get good representation in this trial so that, this type of new technology can, that patients can get access from all different backgrounds.
And correct me if I'm wrong, Dr. Crew, African-American women and Latina women, they have a higher mortality rate when they are diagnosed with breast cancer than white women.
Yes, that's correct. So they tend to be.
Oh, I'm sorry, go ahead. I was just going to ask, is that because they come in later or far advanced when they come in, or is there, you're trying to figure out why, if they're coming into you at the same time, but something else genetically is happening?
Right. So it's a variety of issues. It's true that breast cancer is more common in white women, but African American and Hispanic women tend to develop breast cancer at a younger age and tend to develop more aggressive disease. And a lot of it may be due to the biology of their cancer, but also just access to care and making sure that even if they have an abnormal mammogram, that they have good follow-up in terms of their diagnostic workup and also in starting treatments. I think that's where most of the disparities are, is like access to care.
So the message still resonates for our Black and brown women that to get to know their body early. If you find something that is abnormal and you have your provider who tells you there's nothing to worry about, the biggest advocate for your health is yourself. So please pay attention to yourself, because the numbers, statistics, they're saying that something is, is happening in our community. And other studies, they have shown that when you look at, for example, pain, folks who are of color, they tend to be undertreated. I'm not sure how it looks in breast cancer, but, advocate for yourself whenever you think something is not correct. Then there's nothing wrong with looking for a second opinion.
And I think we have to just push this information out more in our communities too. There's the, I don't know what the Irving Medical Center has available in terms of mammogram trailers.
Educational.
There are those mobile vans. And I know that connected to Heritage Healthcare, there's a mobile van that comes to that area at 145th. I think it's once a week. It may be by appointment, but I believe it's once a week. I'm not sure how that will change or has changed, but we really have to push that further. And I know Memorial Sloan Kettering is connected to the Ralph Lauren Center now with the mammogram checks as well. So we just have to push out information. Is there something available? I'm not sure if there's cost involved, but is there something community-wide that the Irving Medical Center provides that maybe we're not aware of in terms of testing?
Sure. So Karen Schmidt, who's a nurse at NYP, runs, I think it's called the Manhattan Cancer Screening Program. It's for individuals who are uninsured or underinsured, and it provides patient navigation and free cervical, breast, and colorectal cancer screening. So that's available to anyone who lives in the 5 boroughs.
The Manhattan Cancer Screening?
Yes, we can circulate information to you, but it's something that we do offer to the community. And if they're eligible for public insurance, then we can also hook them up to a primary care doctor as well.
Thank you.
Okay.
And quickly, is there any program that starts to educate our women? Sorry, I have a 8-month-old multitasking here. Is there any program that educates our women early in high school, where the center goes and starts this conversation early? Because sometimes we start late in the process, and that is a little bit harder for folks to pay attention to you. And sometimes we catch things late.
Of course. So I know that Mary Beth Terry, who runs our Office of Community Outreach Engagement for the Cancer Center, does do a lot of outreach to the high schools to help educate them about environmental factors, but also just general cancer risk factors that they can also pass on that information to their parents and grandparents as well. But there is outreach that's going on through our Office of Community Outreach and Engagement to educate them when they're really young.
Well, thank you. That'll be something that it can be shared with us, we appreciate it, because I was not aware of that program that you guys have, and it can be very beneficial,
Yes,
especially in this community that suffer from many disparities, one of them being cancer care. And, when you continue to stratify, breast cancer care also.
absolutely. Thank you so much, Dr. Crew. I don't know if there are any other hands up. If I'm missing someone, let me know, just give a shout out. But thank you so much. And we look forward to our June meeting. We have you guys coming back, another team with another trial that's underway. So we really appreciate this partnership.
And thank you.
It was my
And,
pleasure. Thank
and
you.
any recruitment flyer that you have for the study that you're trying to enroll healthy individuals to understand their cancer risk, you can share with us. You can send it to the community board and to our community partners so they can reach out to the center, because this is how we can better serve the community by understanding the phenomena that are taking place.
Yes. And you have our
Thank you so
emails
much.
also from the notices that we've sent. Edwin and I, will get out that information as well. We'll really push. So you've given us some homework, some very important homework here.
All right. Thank you very much.
Thank you.
If anyone can share the center information in the chat, somebody asked us, do you have any contact info? So the Cancer Center, if you can share the information.
Put it in the chat, yes. Okay, next we have Hope in Harlem Conference, a celebration of community, mental health, and wellness. It was announced at our general board meeting last week, and here to talk with us about that further, not just the conference, but to actually discuss mental health from the perspective of the Icahn School of Medicine at Mount Sinai are Dr. Hankerson and Dr. Tawfiq. So let's see, I'll make your co-host, give me a second, so that if you have slides or other to share with us.
And while you do that, this is very timely because May is Mental Health Awareness Month. So thank you for coming and speaking on this very important issue.
Okay, let me find.
I'm Amber Stacks, and I will be speaking on behalf of the Icahn School of Medicine in place of.
What is your name?
Amber Stacks.
Okay, is there anyone else here? Because I was looking for the names and I didn't see. So I'll make you a co-host. I'm not sure if you have slides or other.
I have a few things to share. Thank you.
Okay, so I just made you a co-host. So Doctors Hankerson and Tawfiq are not here.
Yes, they're unable. They had a conflict. But
okay, is there anyone else? Because I'm not recognizing names. Is there anyone else that I should make a co-host with you?
No, not to my knowledge.
Okay, so let me now. Okay, you're all set.
Perfect. Thank you so
much. Welcome.
Good evening, everyone. My name is Amber Stacks, and I'm a program manager at Icahn School of Medicine under the Institute of Health Equity Research. And yes, in honor of Mental Health Awareness Month, we're happy to bring to you our upcoming conference called Hope in Harlem, which will take place on Saturday, May 13th from 10 a.m. to 1 p.m., followed by a wellness fair that will be located on 116th Street between Adam Clayton Powell and Frederick Douglass, so 7th and 8th Avenue. In our event, we are highlighting community members and informal healers. The goal is to bridge institutions, healthcare institutions, and community members. So we are highlighting the innovative practices between those So we have in our panel discussions, faith and community health partnerships, as well as highlighting non-traditional youth programming. So I will share just our flyer here. We have a few different speakers. That also will be joining will be the Commissioner Ann Sullivan, as well as Congressman Richie Torres will be joining to share his wellness journey. He is a strong proponent of mental health. We found that it would be impactful for him to be able to be there and share his story. Dr. Sydney Hankerson from my team will also be joining and sharing their partnerships between the Hope Center, which is a mental health clinic that provides free resources to the community and affiliated with First Corinthians Baptist Church. Our keynote speaker is Trisha Hersey, who is a New York Times bestseller of Rest is Resistance. We found that her story of really speaking to rest as a communal practice, but also personal liberation would really be able to show that, and just really taking personal mental health care first, so that if you're taking care of yourself, you'll be better to serve others around you. A key part of our programming is Heroes of Hope. We would like to honor and highlight those who have done tremendous work formally and informally throughout the pandemic. So one thing that we would like those on this meeting and in your community would be to nominate folks that you feel deserve that honor, and just sharing that. So I'll be able to put that in the chat, as well as our conference website. Here we are. And here is our formal agenda here. During our wellness fair, we'll be having yoga, sound baths, other healthcare organizations within the borough and New York City that will be able to help families, individuals sign up for healthcare and other informal practices. So if you also are available or know any organizations that would be interested in joining us, we have a few spots left and open to community input and able to add to our street fair. Although this is mostly the conference will be targeted towards adults, the Hope Center is hosting a Youth Mental Health Action Day on May 18th at 3 p.m. So I'll also be able to share that information. We're excited to share the resources with everyone. We're looking to promote it more, share with your resources and networks. And yes, thank you so much. Oh, also, we're offering free CEUs for physicians, social workers, and psychologists 3.0 for 3 hours. So if anyone is also interested in receiving credit, you can visit our website, and we have a registration link that we'll be able to document. And open for any questions that anyone might have.
Oh, thank you, Amber. Is Sinai doing any mental health program in Community Board 9? I know that we have Morningside, which is one of your campus. This is a great event, but it will take place on the other side of our district. Anything that will be happening in the month of May, I'm sorry, in CB9.
I can confirm with the Morningside campus. For sure, I'd get back to you.
Yes, please. If you guys can share that with us, it will be nice so we can disseminate that with the community.
Perfect.
I guess I'm just a little. Well, I was hoping to, a lot of times with our presentations, we're looking to delve into maybe data and statistics and things that are happening in the mental health area. There's a lot going on in our city where, mental health issues have made people more aware. So I was myself looking for a little bit more, not just a presentation of what's, because we all got the flyer and it was presented at the general board. So we, in our letter, requested something a little bit more in depth from the standpoint of how we help our communities from in terms of mental health. And maybe there could have been some example of something going on, and then how you delve into, going to work and helping us to improve. So perhaps at another point, these doctors or the ones whose names were mentioned or other doctors can come and talk to us and provide some guidance on what we're confronting, because we have had psychologists and come as we've been dealing with, subway incidents, domestic violence. We have presenters that come in and really tell us some information we may not have or we may not know how to tackle, and we have to help somebody. There's somebody we know that's going through something. And that's what we use the committee, that breakdown in the committee, to try to uncover, expand, and explore. Not necessarily name names, because there'll be others that have really deep, intensive problems, but we can't be on the surface of these. We have to really be ready to delve into some of these issues to the extent that we can, and be given some guidance on how to help the community. So I know that's not your area, but again, we had someone come and present to the general board meeting. Those members, those committee members are also part of the board. So we heard that. We were looking to hear a little bit more about how the department works and some of the things you confront, and give us some advice as a community board and how we can help our people, because we're facing some tough issues and we can't tackle all of them.
Right.
There's a lot, but we were looking for something that you could bring to us.
Yeah, I could just briefly, but yes, Dr. Hickerson and Dr. Turfy are definitely be better versed in their studies and research and work. But one of the reasons we have chosen First Corinthians Baptist Church is that people in the community seek mental health services in churches, or more likely to receive services or seek services in churches and informal places. So that is one of the reasons why we located the conference there. But also there is a study Dr. Hankerson is working on for community health workers. So you're able to pair those churchgoers, and we're trained church goers and community members to screen for depression and anxiety, so that those who enter into the building are able to receive a handoff into getting services. So I do understand definitely what you mean, and that it is a rising rate. Definitely the rate of suicide and youth suicide is increasing. Yeah. That is also one of the target points that we would like to highlight in the Youth Mental Action Day, to build resilience within the youth, and take it from a different lens, as far as instead of just harm reduction, but how can you build youth up so that it's before the fall, it's before crisis.
Thank you, Ms. Stacks.
I would say that, Amber, what you can do is, bring the QIDA feedback back to the center, and that information can come back to us and be disseminated to the broader community. And there was a publication by the Pew Research Foundation in which, when you look at the attendance of churchgoers, the younger demographic and Latinx community has been declining. So perhaps this is, a good service that is being provided from the trends that have been seen historically. But what we see is that a lot of folks in our community, they are dealing with mental health crisis. Some of them will go to church, some of them they probably are not. So whatever information the center has gathered so far, they can bring that back to us and tell us how Sinai is addressing this. How, not only is the data being collected, but how is it being then addressed? So we'll look forward to having, you guys next month to look at, some of these issues.
I have a question. Laquita.
Okay, Monica, go.
What are you doing to get the word out about this program? Because I was in another state and I attended another church program. And one of the complaints about the community is that nobody in the community knew about it. So what are the steps you taking? I know about the Reverend and I know about Community Board 9. What are some of the steps that you're taking to make sure that people in the community know about it?
Thank you. Aside from social media posts and kind of electronic outreach, we're also going door to door, handing out flyers.
Okay, great.
We have large banners outside of the Hope Center.
Okay.
Highlights program, so people walking by and just foot traffic are able to see.
Okay, great.
Presently,
Great,
yeah.
great, great. Yeah,
And
good.
really
Thank
just
you.
word of mouth. Thank you.
All right, thank you.
Okay. If there are no other questions, thank you so much, Ms. Stacks, for coming. And we hope, I think we have pretty widely distributed that flyer to our constituents and, from the district office. So I'm hoping that a good number of people will come there. And I know that that's Community Board 10. So here among Community Board 9, I'm hoping that can be replicated in some way here. And, we can help locate a place. So I'm sure you guys can do that as well. To just make sure as many of us is helped as possible. Okay. Thank you again.
Thank you for coming.
Thank you.
I'm not sure if someone is here from DOH or if DEP, a representative from DEP has shown up. Let's see here. Oh, is that who you were looking for? Edwin, DEP?
Yeah, is anyone here from DEP or DOH?
Hi, good evening. My name is Juani Rodriguez. I'm here on behalf of Padmore.
Oh,
great.
hi, Ms. Rodriguez. Thank you. Okay. So do you have an update for us or information from Department of Health and Mental Health?
Yes, so I have a little bit of information on our recent data for COVID. Unfortunately, I think that we were supposed to have another representative from the Department of Health. I think his name is Kenneth, to provide a little bit more updates on general health stats, but I'm not sure if he hasn't joined yet. So I'll just share that right now.
Well, do you
Sorry.
want to wait to see if and come back to you if you think he's gonna?
Yeah, we could do that.
No. Okay, and then you could put something in the chat, or we'll just come back after the Ladies of Hope Ministries. Okay.
Sounds great.
Okay. So I think it's Annie Reynoso, who from the Ladies of Hope Ministries, who will give us an update on their agency and the Angel Food Project. Annie, let me make you a co-host.
Thank you.
Let's see, I always have to go through a little process here. So that should be coming up. Okay. Ready? Okay, Annie. And also because I failed to, in this reiteration of the agenda, to have your name and affiliation mentioned here. So just give us that information as you open your presentation. Okay.
Hello, members, and good afternoon. My name is Annie Reynoso, and I'm the Program Manager for the Angel Food Project at the Loam. I joined the Loam early in November last year. I just wanted to share a quick overview of the Loam and updates for the Angel Food Project. The Ladies of Hope Ministries mission is epic, ending poverty and incarceration for women and girls. We empower women and girls to create sustainable lives post-incarceration. We drive this change by connecting them to housing, food, healthcare, living wage employment, entrepreneurship opportunities, education, and advocacy. The Angel Food Project is part of the Loam. Its mission is to relieve the stress of poverty in impacted communities by making connections to free, high-quality food. We partner with local supermarkets and restaurants and grow our own produce to provide them to the community as well. So what does hunger look like in the West Harlem community? 20% are children, 16% are veterans or active military members, 23% have to choose between food, medicine, and daily expenses. 60% of households have an annual income of below $18,000. I wanted to showcase here some of our amazing partners working with the Angel Food Project. With the support of these partners, we have been able to create significant engagement and impact within these communities. With the support of West Harlem Development Corporation, we have provided over 4,000 bags of groceries, subsidizing over $86,000 of groceries for Harlem residents. 82% of our families who live in Manhattan live in the West Harlem area. With the support of Adobe, we were able to provide over 1,000 health and hygiene care items to the community. We partnered with Coda Alliance in honor of Women's History Month this year, and were able to provide over 100 West Harlem residents with over $2,000 of groceries. And this included produce grown and harvested from the Loam's hydroponic garden at Hope House Bronx. In 2022, the Loam partnered with Growing Peace to install a hydroponic garden in Hope House Bronx. We can produce over 240 pounds of food a year. The food is provided at our food drives, it's given to Angel Food families, and donated to organizations that serve families in need. The Angel Food Project is looking to increase its impact in West Harlem by increasing its partnerships, expanding our hydroponic garden within the community, and creating more storage spaces for our produce. If you or a partnering organization are interested, feel free to reach out to me. If you know of anyone who can benefit from the Angel Food Project, you can contact me at annie@theloam.org. If you have your phone with you right now, you can scan the QR code on the screen, and we can send you the registration forms directly to your phone. I can also email them to you if you like. And before I close, allow me to highlight our recent partnerships with Google. The Grow with Google Career Skills for the Justice Impacted curriculum is designed for community organizations and practitioners who support formerly incarcerated and justice impacted people. The Loam is proud to be one of the 5 partners who helped create this curriculum. We have also committed to providing this training to at least 1,000 justice-impacted women using a gender-informed approach. We are offering a variety of virtual training options to women and organizations. If you know of anyone who can benefit, I will share this information in a follow-up email. And on behalf of the Loam, thank you again for all your support.
Thank you, Annie. I'm not sure if there's any other comment. Let's see. Any questions anyone else has? Whoops. Any questions? If I remember correctly, Annie, is the Loam a West Harlem Development Corporation grant recipient?
We are.
Okay, so this was part of your making us aware of your project and what you're doing. Okay.
With some of the statistic that was shared, Annie, it wasn't clear the timeline of the distribution. You know, was it throughout the lifetime of the institution? Was that in 2023? I didn't get that from the presentation.
Yes, so we received the stats from B Health, and that's from 2021 to 2022, and I can share that with you as well.
And that is when you said that you guys distributed, I think it was $85,000 in food. Was that through the lifetime of the organization or in 2022?
Through the lifetime of the programming, yes.
Okay. And how long has the program been running?
The Loam, the Angel Food Project, has been running for about 4.5 years.
Okay. So over 4.5 years.
And this is food particularly for those who are formerly incarcerated, who may have, well, because of not being able to find work or whatever, low income, cannot afford food as readily. Is that correct?
So we also service individuals who are impacted in the community, so that can fall under an umbrella. Individuals who may have a need, we can also service them as well.
Okay. Anyone has any questions?
How do you find, how do people find you? I know you're presenting to us, but when you mentioned the incarcerated, when they leave the facility, are they given a list of places where they can find help, such as food or shelter if they don't have family, or even if they do have family? How do they find you in terms of the formerly incarcerated?
Yeah, so the Loam, the actual Ladies of Hope Ministries, we also have a housing, transitional housing as well in the
Yeah,
Bronx.
but how do they find you?
Yeah, so some of them are referred from other organizations. In the Angel Food Project, we do have boots on the ground, so we have outreach that happens, and we put up flyers and information as well.
Oh, so the housing part wasn't mentioned in the presentation.
Yes, so the presentation was specific to the Angel Food Project, but the Ladies of Hope Ministries does have other projects that are happening simultaneously at the same time.
So those other projects are not funded through the West Harlem Developmental?
No, just the
No.
Angel Food Project, yes.
Okay. I would suggest that you guys come back to us and give us a presentation on the services that you guys provide, not only on this program, which is a great program, but you know, folks might benefit from seeing the array of assistance that you guys are providing. Perhaps, you know, we have folks here who have organizations that can, you know, refer to you guys or know of your existence. So knowing about those other programs and how successful they are and what you guys are doing will be very helpful for the broader community when, you know, they're thinking about your organization.
Absolutely. We'd love to come back and explain more. Thank you.
The Ladies of Hope Ministries, it might even be great. I'm not sure if you are involved with the Seniors Resource Fair that's taking place tomorrow,
Mhm.
but I'm going to email this. I just emailed it to Suzanne, the flyers. It was easier for me to do. Heather put something in the chat. But let me email this because that might be an important place for someone there to be tomorrow. Even though it says seniors, if they are, oh, and Bailey is asking for you to put your information in the chat as well. But they reach a lot of people in terms of the seniors committee and all.
And let's
Um,
remember also, Laquita, that in our community, we have multi-generation families. And a lot of times the seniors, they are gathering information and they're bringing it back to their home. So you might go to
Exactly.
a senior
Good
event,
point.
but at home they have, the younger family that, might benefit from listening to what you guys are offering. So this is a great event that's going to take place. And I know it's senior Taylor, but the seniors are very active in the community with the younger generation.
Exactly. Mm. Okay, thank you very much. And just be in touch and see if you can come back with an even more comprehensive or someone, actively involved with the entire agency, because it sounds wonderful and it sounds like information our community can use.
And they are,
Absolutely.
and you guys have, you said, the facility in the Bronx, but you guys are located in our community, right?
We're in Harlem. We're in 8 West 126th Street.
Yes, so that's right in MCB9. So yeah, we would love to continue to hear more from you guys.
Thank you. Likewise.
Okay. I see who is next. Agenda. So Juanita, do you want to present what you have? I'm not sure if your colleague has come. If you mention his name, I can certainly make him a co-host.
Yes, unfortunately, it seems like he has not joined. We've been usually we have another person who has been presenting at these meetings, but she's been
Right.
sick for the past month. So hopefully she'll be returning in the next CB meeting.
Okay. Do you need to be made a co-host? You have slides or other to show?
No,
Okay.
no, I don't.
Okay.
I wanted to briefly share some updates on COVID. Currently, we're seeing decreasing rates for percent positivities, and our daily average cases have been going down significantly. Within West Harlem, we are below the daily average for deaths and hospitalizations, with only 8 cases reported between, 8 new cases of hospitalizations reported between March and April. So that's really great. And then I also just wanted to quickly promote some of the East Harlem Health Action Center's services, since we do have quite a number of services, and I can include our one-pager into the chat. But I just wanted to briefly promote specifically our Baby Cafe and our Family Wellness Suite, which promotes healthy parents and caregivers and babies. These have classes for folks who are becoming new parents. We also have a crib and a crib distribution and a diaper drive. And I'll add all of this information into the chat. We also have breastfeeding classes, breastfeeding support groups. We have a couple of new classes for new moms, as well as, sorry, I'm forgetting right now. New yoga classes for mothers. And a couple of new organizations as well. So I'll add this all in the chat. And I guess I'll just pause here.
And how do you find the participants, Juanita? Well, not you personally, but are flyers circulated at hospitals and in maternity wards, or how do they, how do you find people and help determine those who could really use the aid and the assistance?
So the services are available for any new moms within the 5 boroughs. Currently, we've just been promoting to our partner organizations who have services that services within the community. And we have flyers available, as well as all of this information is also on the East Harlem Health Action Center's website.
So I would imagine you would have a lot of people responding to you. How actively.
So we do have a number to call, and most of the referrals are handled through the program coordinator specifically. There's a program coordinator for Baby Cafe, which is for new mothers, and the Family Wellness Suite also has a coordinator who specifically handles any incoming request or participants who would like to join.
Hi, good afternoon, good evening. I have a question. Most of those programs or services are available for East Harlem. But what about this CB9? Do you guys partner up with any organization that's specifically for West Harlem, like 131, like 100, even 132 zip code?
Mm-hmm.
So
because it's really hard. I mean, like, I'm just saying, like, when my son was little, it just to think about the fact that I had to take a train and a bus to get to 116 or 110 all the way on the east side, it wasn't really like worth it. Do you guys offer like home visiting services to this particular area?
Good question.
So currently, our services are available. So we're currently the Bureau of Neighborhood Health for all of the Manhattan bureaus. So our services are particularly targeted to upper Manhattan folks, but I do understand that it is the Action Center is located in East Harlem, and then we have another location in Central Harlem on 110th. We do have some of these organizations that I'll share do have partner organizations and different locations, but I think the majority of them are in East Harlem. We do have one program, which is the newborn home visiting program that does provide support for parents. I think it's up to 3 months old, and they do have health professional visits to parents and their babies to share any health and safety tips. So I think that's the main one that does home visits. And like I said, the other organizations that we do have co-located within us, I'm not sure to the extent to which that they will travel, but I definitely do know that they have services available for all of Manhattan.
So Juanita, you might not be able to answer this question, but how can we get those services so they can be accessible to the folks in CB9? It's great that they are in other CBs, but transportation is a problem in New York City. The more folks have to get on a bus, on a train, the less access we're going to create. Is great that the Department of Health says we have them in Uptown, but Uptown is a pretty big area. So we need the OH to bring these services to CB9. And how can we make that happen?
I completely agree. I think that it's really unfortunate that most of our services are located right now in East Harlem. And like I said, we are partnered with other organizations that do work in West Harlem, but I can definitely elevate this, like I said, to our assistant commissioner, to Pat Moore, and get back to you on how we can make these a little bit more accessible.
So
and to list some of those partner facilities too, that could be helpful.
So we will be following up on this, and we hope to hear from you guys in our next meeting on action plans on how we can make this happen. And
I
the other-
have a question.
Go-
I have a
go, Monica.
question. This is Monica.
Yes, Monica.
What's the budget for your programming now in East Harlem?
I don't have that information. Yeah, I don't have that information. I'm sorry.
So can you please get that information for us and bring it in the next meeting so we can understand how, the program is functioning? So when we're looking to create something similar in CB9, that we can have, something that is equal to what you guys are doing on the other side of the community.
Do you know, let me ask one other thing, too. Do you know if there was a program in West Harlem and then maybe it got cut from the budget?
I don't believe so. So the East Harlem Action Center, like I was mentioning before, is part of the Bureaus of Neighborhood Health, which were established in each borough. One action center was established in each borough. So the East Harlem Health Action Center is the Manhattan Bureau of Neighborhood Health. And then there's one obviously in the Bronx and in the other adjoining boroughs. So I believe that the services that we provide are for all of Manhattan. But yeah, I don't think that there was a specific one to CB9.
So you guys have the data of who you guys are servicing, and those folks that come over, they provide you with a zip code. So if perhaps you can let us know how many folks from CB9 are attending your program. You can see that by stratifying by zip code, and then we can see if our community is having access to this. And if they are at a disadvantage compared to others, then we have to ask the question why. So that's information that DOH should have and should be able to put together, and hopefully we can see it next month.
Yes, I can definitely, I've been taking notes of all of the questions you have mentioned, so I'll definitely make sure to elevate these and hopefully have an update for you all.
Thank you, Juanita.
And the other is that we ask DOH, we send an email, they can speak to us about the impact of pollution, and specifically how that is impacting West Harlem. We know that pollution increases the rate of respiratory, cardiovascular, and other illnesses. And CB9 has one of the highest rate in Manhattan. So the response that we received from Mr. Johnson was that somebody will be presenting. That person is not here. We're still expecting for you guys to come back and give us that information, because we have various issues taking place in this community where we see trucks, commercial trucks that are parked all over the place. We basically have a scatter truck depot in Community Board 9 that's taking place overnight. So we want to understand, the pollution and how it's impacting us, because we're, putting together an effort to help our other agencies understand that when they're not enforcing DOT rules, that this has a direct impact on health in our community. Everybody was, very concerned when we had a truck depot that was, initiated on 145th. And that was, a very valid concern. But now we've been having trucks scattered all over the place. So if DOH can come back to us with the information of pollution and the impact that it's having on our health in CB9, because our lungs of every resident in CB9 is cleaning all the fumes that these trucks are spewing in the morning right before they turn them on so they can go to their destination. So please, have DOH get back to us with that.
Yes, I'll make sure to elevate this.
Thank you.
So what in our committee is trying to do is listen to issues, listen to our community, and really try to improve and tackle some of these dire circumstances. And Edwin really brought us into that very nicely. We have a number of letters of support based on complaints that have been registered. We put forth resolutions, but we don't want them to just die in committee or die with the general board once we get a letter out. There has to be accountability. The agencies and entities involved that we send a letter of support to, we hope to hear from them and try to help resolve the problems, and it makes for healthier people, healthier community for sure. So each month, we plan to provide some update and keep those updates on our agenda until there is some resolution. It's not being mean or anything like that, but we really are serious about wanting to help and get an answer. And we find that certain things that are happening in our neighborhood wouldn't dare happen in other communities. And so it's important for whether it's sanitation or transportation to know that we are serious about helping our communities, and we can't just be a dumping ground or overlooked. Sometimes there may not be any feedback, so we'll let you know. And so therefore we'll start with a couple of things. We send a letter of support to on behalf of one of our members, but also a member. There are others in our community who have had similar situations as it concerns protocol and help in hospital settings. We've gotten some response, but we haven't had the meeting that, for example, from Mount Sinai, as it relates to youth admissions in psychiatry. We want to really press on that because the mother of that young person was very brave in bringing the issue to our committee and to the community board. And there's so many issues that come up where parents really don't have anywhere to go, or those that want some help just really have no place to go. And then they give up. And we don't, the fact that she came to us, we want to do all we can to try to establish that rapport. And not only for her, but when we help her, we'll be helping others that face similar situation. The issue of mental health is important, not only among adults, but also in terms of youth. And we often forget until something tragic happens. So we've always had a good rapport for the most part with Mount Sinai. I remember Mr. Gianelli, president of Mount Sinai, attended a number of our committee meetings and board meetings. And so perhaps we'll, be able to get him back, but we have to reestablish that rapport and get some answers so that we can.
Lakita, I
Yes.
came to the meeting tonight to discuss this. It's Brad Korn from Mount Sinai a little bit.
Hi, Mr. Korn. Thank you. Thank you very much.
Yeah.
I didn't know formally, if that was going to happen, so I didn't want to say that yet. So
thank you, Brad. We'll come back to you. Let's finish with DOH.
Oh, I thought, okay, that's what I thought.
No, I had pretty much. I had pretty much finished with DOH and was moving on to feedback on the letter of support and all. And
we have somebody who wrote, noise pollution, and I wanted to see if DOH has any data when it comes to noise pollution and the impact that it's having on health in our community. before we
Can
come to
we,
sign.
can we do that under C and D?
So,
I was handling A and B on under feedbacks, and that the noise was under C and D.
well, I mean, we have Rodriguez from DOH to see if she can, if that's something that she can bring next time.
Oh, okay.
Ms.
Yes, hi. I'll definitely add it to my list. So I'll definitely elevate it and hopefully have an update.
Thank you. And C and D, we'll come back to it, but just so we can get DOH and their perspective on the impact on health.
Okay, got it. Okay, so she's gonna come back.
Yeah.
So to continue, thank you, Mr. Korn, for
Brad,
coming
please call me
and-
Brad. If you call me Mr. Korn, I have no idea who you're talking to.
Okay, so welcome.
Thank you.
And we're ready to hear you.
Okay.
And then of course you can come back if there's something
Yeah.
more
So
outlined.
I'm gonna go back to the start of your agenda just to let you guys know that we have both a mammography van and a prostate cancer van that we could, I don't deal with the scheduling directly, but we could try to see about getting some stuff in the community to come do screenings to that.
Fantastic.
I didn't
That's
want to
important.
jump in while some other hospital was presenting, but I just want to let you know that we have that available.
Very excellent. Okay.
As to the letter, one of the issues you raised in it deals with policy, and policy does not change overnight. Things need to be looked at, and that's they'll be working on. To the other end, though, the patient experience people that we added, I do think would go towards dealing with a number of the communications issues that the person you referenced in the letter had. So we're making moves in a positive direction to help with those things. As far as the policy, we don't have a decision on that yet, but I will come back to you as we move forward on that.
So Brad, we are concerned with, policies, they're not written in stone. These are fluid documents and they always change.
Absolutely.
And we are very concerned that we have a pediatric patient that was placed with the adult population.
I understand.
We wouldn't dare to do such. If I had a cough, if I had a broken arm, and I go to the ED, that will place me in a pediatric patient, in a pediatric population. And when we're speaking of mental health, that is something that, brought a lot of concerns to us, especially with that experience that was described. We have to recognize that the person involved has a lot of political capital, which is not what everyone else in our community experienced. What do I mean by that? That this person knows where to go and complain when the issues are not being addressed. And hospitals, they have their internal ombudsman office to advocate for patient. This person, did reach out to such offices, but we want to be sure that this doesn't happen again to anyone's kid. And it is concerning that, the policy is still in place as of this moment.
Correct. And the policy may not change because, again, and I see Amber's still on, but I don't want to have her getting involved in this because it's also an ED policy. So they're still looking at that, and I'm happy to go, obviously I'm advocating for the points you guys made, but I will follow up with you to see where we're going with that. I will say, as a large part of the problem that was faced with the patients, the person, was a communications issue. And as I said, the patient experience people being around and having hired more people to follow that would help tremendously. We expect will help tremendously with that aspect of it. As far as the policy, we will, no decisions have been made yet. We will follow through with that with you guys.
Yes, so we look forward to seeing, where we're going to move with this, and the reason as to why keep it if it's decided, right? I'm sure that there is, the literature to back such decision.
Right, absolutely. If there are treatment protocols and there are standards of practice, which is what I believe they're I'm not clinical, much to my parents' chagrin. I am not a doctor and I don't play one on TV, but I do advocate for patients and for issues, and I will definitely, like I said, I will continue to follow up, but this has not been changed as of yet, and I will continue to follow through and follow up with you guys on that.
Okay, this is Monica Dula. So I'm gonna come to it from a legal standard, right? I mean, there's the industry protocol, what's customary, right?
Yeah, okay.
And I want to know what's customary for a young person who gets taken to the ER. What is your standard practice?
And I can't tell you, Monica, I'll get that for you. I can't tell you that off the top of my head.
Okay, but I just want you to take a look at that. What's the standard by which the hospital's actions are judged? That's all I want to know. Because
well, I think you want to know what the standard delivery of service is for somebody of that age. That's
of
not.
course, what's the
Yeah.
standard protocol? That's
Right.
all we want to know.
Okay.
And we want to make sure that not only for this incident, but that emergency room is following the protocols for everything that they're supposed to be doing. This is one example. I don't know what else is going on or not going on. I'm sure that you guys have reports. But we're just trying to make sure that this doesn't happen again. And we'd appreciate it if we just got a little bit of feedback from the hospital.
Understood.
Okay.
And Brad, the other is that we will have a meeting with Sinai in regards to the contributions that are coming back to the community. Know that the institution is a 501c3. It gets tax break from the state, from the federal government and the city. And that comes with a fiduciary duty to, provide to where you guys are, located. So, I know that
we do a community benefit report every year. It's on our taxes. You can see all the things that we do. We are, in fact, in recent times, we've been one of the highest returners as hospitals for community benefit in being registered. So,
okay.
So this is great. We would like to have a meeting so we can go over this, because a lot of times, I'm sure some of these are great programs with great intent, but to have the community feedback helps us, sort of see some of the blind spot that we might have, even when we have great intentions.
Well, I will also tell you that we're on a slightly different schedule than some other hospitals, but we also will be doing our community health needs assessment this year. And I clearly will have our people reaching out to the board to bring us people to talk to and get feedback on that as well.
Thank you. And if you have the previous community need assessment that you guys did, if you can share that with us, that would be nice. So we can.
I will tell you, it's basically 3 years old now, and
Right.
I don't want to. I don't want you to be. How can I put this? Since it was literally being done during the COVID era, let's look at the next one, because it was such a weird time the last time we did it. So, I mean, we can show your community service plan. We can show that it's all on our website. I'll get you that stuff. But,
yeah.
The last one was a little weird only because of the times we were doing it in as well.
So send it to us. We'll look at the past community need assessment that you guys did.
Okay.
So we can then, because you can always learn, even if it wasn't the distress era.
Yeah, no. And that's why I'm saying that I'll make sure that we're reaching out and having feedback from you guys. But we do a great deal of work in the communities, a lot of screenings, a lot of flu shots, a lot of other programs and everything all the time. Plus the medical school does a tremendous amount of work in the communities and such. I mean, we do give a lot.
Yes.
but we can follow up. Reach out to me if you want to set up a meeting to talk about more about a smaller group getting together to discuss stuff. I'm happy
Yes,
to
that's what I
facilitate.
let her.
I'm happy to facilitate that. Okay.
Yeah,
That's great. But there
Yeah,
will be
thank you.
about, there will be a few people, a couple who are not on our
That's fine.
immediate committee,
Okay.
but that would be
Because-
very important.
Brad, looking from a broader perspective, when you look at, our community, we have worse health outcomes in other community. So, with all the great intent, some of that is not permeating to try to, help us deal with those inequities.
Okay.
So this is something that when you have community input, like I said, it helps you see those blind spots that sometimes when you sit in, from one perspective, you might not be able to see.
We're happy to always, we are always happy to sit down and listen to the needs of our community.
Mm-hmm.
So let's see if we can get something together, during the month of May. If you give us a couple of 2 or 3 possible dates that would be good for you, then we can, or us vice versa, we'll see who would be involved in that discussion, and try to tackle this sooner rather than
Okay.
later. And thank you so much for
Thank you.
coming. I knew there was
Yeah.
correspondence, but I wasn't sure
Yeah.
if you were prepared to make any statement.
No, I like I said, it's still a work in progress, but as I said, we have added some things that will enhance will take care of some of the issues that were, encountered there.
Thank you.
Well, thank
Okay.
you.
Have a good night, folks. I have to sign off to go on another meeting, so.
All right.
Okay, Brad, thank you.
Take care.
All
Bye-bye.
right, bye-bye.
And so Edwin, now we can move to the pollution, noise and air. Under your, because we had 2 resolutions. Well, one was you had written on, but it wasn't submitted beyond to the Uniform Services and Transportation Committee. And then we did one that was passed on, oh no, for noise. No, that one wasn't passed, but it hasn't been written yet, I think. But anyway, your updates on your resolution, the C and D.
Do we have anyone from DEP? They haven't joined. So I know that the folks from Todos Nosotros, they've been showing up to different meetings, complaining about noise. So I think that, if they want to, make a statement of what is going on with their situation and noise pollution, that'll be a nice entry into why we're going into this resolution.
Okay, so yes, there is someone who put something in the chat. I don't know if that person wants to
Let's see if
make
anyone.
just a statement.
They say I
No.
can speak.
Yes, go ahead, please, quickly.
Yes, good afternoon, good evening, or good evening, everyone.
Hello.
Yeah, so myself and my fellow residents have already sort of appeared in front of the general board, and we have given our testimonies of everything we've been going through. But essentially, it's 2 businesses. One is called Billiards and Bar on 3428 Broadway. The other one is Picante on 3424 Broadway. And I mean, we have just blasting loud, heavy bass, nightclub style music permeating through our apartments that we literally cannot shut out. I mean, it gets through our closed windows. There's just no stopping it from getting into our apartments. Billiards actually goes till 4 a.m. almost every night. Weekends are absolutely horrendous. We feel like there is a front row concert in our apartments. We're literally sitting at a concert full blast till 4 a.m. It's absolutely disgusting. We cannot sleep. We're forced to stay awake and wait till they finish, because there's just no way for us to go to sleep. It's highly impacting our health, our peacefulness to enjoy our apartment and the comfort of our own homes. We're unable to do that. And I don't want to say this, but I think it's best that all of you guys know this. It looks like, from what I can tell, even though myself, and all of my fellow residents and tenants have come forward at the last general board meeting and made our statements so that the entire board knew what we were going through. They have gone ahead and still given Picante a renewed liquor license for the next 2 years. I feel it's important that all of you in this committee are aware of this and are able to find out when that happened, why that happened, and hold people accountable, because as far as I know, there was not a vote on that. So I want to let all of you guys know this so that you can address that and figure out why this happened and why that was done, when we specifically sat here and said something about this.
What is your, sir,
what
what
you-
is your name? I just
I go
wanted
by
to address
Todos.
you. Michael?
Absolutely. You can call me Todos.
Okay, so the committee members who are here, they were all at the general board meeting, so some of the details don't have to be rehashed, but the empathy and what we feel is definitely important for you to know. I'm wondering if you took, do you know if the suggestions were taking place where everybody, if you got 100 people, however many numbers of people, to call 311?
We
Do you know if that was done?
We've absolutely flooded them, and so yes, we have absolutely.
Do you know about, do you know numbers though? Do you know how many people did you tell to call and who called? Do you have numbers?
That's a great question. I want to say, through the time, every time we have an issue, there's at least 4 or 5 people that jump on, and what they do is they go ahead and they open up, 10 to 20 311 requests. Most of them get closed within seconds of opening them. So yes, the 30th precinct is just tired of us. And they go ahead
But
and
311, it is because 311 apparently keeps statistics. It is documented with 311, to your
it
knowledge.
absolutely is, Laquita.
Okay.
Yeah.
I'm
it
trying to
absolutely
think of what other suggestion was made. I just want to, so we can say, okay, you guys did everything suggested. The only other thing was someone said hold rent. But if it is held, it should be held in escrow. I'm not sure if there's that possibility.
The other thing is that they should call when the building is overcrowded. You should call the fire department, because
Right, someone
every
mentioned that.
building has capacity.
Yep.
Okay.
Yeah, the fire department can shut them down quickly.
Very quickly.
Yeah, that came up. That was one of the first things that came up, but that hasn't happened, Todos.
It has not. And the other thing I want to say is for the billiards place, we do have, from looking at city records, it seems that there have been 3 inspections. DP actually has come out, so it would have been great if somebody was here to speak to it. There have been 3 inspections, and each time this business has defaulted in court, so they've never shown up to the tribunal. But there are clear readings and clear notes. You could just go on the NYC summons finder and see that there are 3 times that DP has come out and said yes, they've issued summons to court, to the OAuth.
Okay,
Yeah.
so they have done, because at the
They
last meeting, I believe it was stated that nothing, that someone's car came up and but no action was taken. So
I went back and looked. And I see that LLC that business is running under has been cited 3 times, and they have 3 separate summonses. As a matter of fact, the latest one, the court date was April 25th. And again, as far as I know, it was a default. So they no-showed to court.
So the next thing might be the fire department.
I think that we should follow up with Humberto from DEP. So we can probably have a meeting with him, the folks from this building, because that is a DEP enforcement, jurisdiction. The noise situation is DEP who enforces it. and they can, take care of this.
And I want to say, Carolyn has also been talking to the commanding officer at the 30th precinct, and I believe they've talked about a long-term strategy. And Carolyn may have more information on that. She hasn't shared that. But what we're looking for is immediate relief. We're looking for a short-term strategy that's going to really go in there and say, look, guys, you need to either stop this, you're done for the night. We're going to shut you off. That's it. That's what we need. We need someone to really go in on the nights that there are these issues and take enforcement actions immediately. Long-term solution we appreciate, but we need something for that night so we can all sleep. And I want to also mention here, my other fellow resident, I don't know if she's on the line or not. If Sarah Williams is there, it would be great if she would, speak to some of her sort of experience, because she's been suffering a lot as well. I don't think she's on.
I think, well, she definitely spoke at the general board.
She certainly did, as did Natalie
Spoke at the general
a
board.
few others. Yeah.
I'm just wondering about the actions since the general board meeting.
So I would say, Laquita, that for this reso, I would table it for the next meeting because I want to include some of the statistics that I didn't look at the 311 with some of the testimony that we have here, because it's important to have these numbers. So
It is. That's why
when we look back at this reso, I wrote a reso general when it comes to various noise pollution, bar, restaurant, vehicles, and the impact that it has on health. But these numbers are the facts of CB9. So I'll get it done this week and I'll send it to the committee, and then we can pass it, because even if we pass it tonight, this is more of a long-term solution for the agencies. But short-term, what we can do is email Humberto so he can have a meeting with us and the folks from this building about this noise situation. So long-term.
And what time does the noise? Oh, that's when you say sleeping. So it really becomes unbearable starting at what, 8 o'clock, 9 o'clock?
Well, it depends. Picante tends to go, Picante starts to get loud around 9-10 o'clock, and then the billiards really starts to kick it up around 11:30, and then they go till about 4 a.m.
And which nights?
I would say the 3 worst nights really are 4 worst nights, probably Thursday night, Friday night, Saturday night, and Sunday night. Those really are the 4 absolute.
Oh, even Sunday night?
Oh, Sunday nights, last night was an absolute disaster. Even Sunday nights, yep. And I think the other thing I really want you guys to go back on and take this back to the general board is to understand when that vote happened and why was Picante allowed, after hearing us all speak, why were they allowed to get that renewal for 2 more years? It just doesn't make sense to me.
I'm wondering if there's anything on record, if the police department
but the cop, even if we say no, they can still get it.
Yeah.
I mean, as long as there's no kind of police activity, and what do I mean by that? Fights, somebody selling drugs, somebody selling illegal liquor. Yeah. I mean, it's hard to not give a business a license unless something serious happens. Seriously.
Well, for us, I mean, this was impacting so many people. We felt the noise was serious enough, and we took 15 minutes to come to the general board meeting and explain it.
Right. We get it, but the reality is the law set up. Noise isn't one of the things that will allow an agency not to give them a liquor license.
Mm-hmm.
And just to know, this is a renewal license, so it's not a brand new license.
Right.
Yeah.
Right. And
that's correct. Picante was renewal.
Everything. They look at the criminal activity, really.
Mm-hmm.
Well, that's why I wish Sarah was on, because she has reports of tremendous amounts of drunk people coming out of Picante.
But that's not really, I understand what you're saying, but that's not really That's
criminal.
not really considered crime. I mean, drunk people coming out of a nightclub, that's not really crime. What would be is somebody selling illegal drugs inside, someone engaging in sex for sale, someone trafficking girls inside of the business.
Underage.
Sarah has
Right.
documentation of fights happening right in front. Sarah does have documentation of
Okay, but
fights
in
happening.
front, I mean, that's not really good. I'm saying it's very difficult.
So
You know,
what I-
and having
what I was saying-
documentation isn't good enough. You got to call it in.
Yeah,
I mean, if they're outside, you got to call 311 or you got to call 911. But you know, it's very difficult unless it's like real criminal activity.
Monica, we lost you.
yeah. But I would say that DEP has the jurisdiction of enforcing noise volume. You know, and that falls under them. The other thing is that the community board is one avenue. You also have your elected officials. SLA is a state agency. So you have your state representative, your assemblyman, and your senator. So also reach out to their offices because they can reach out to these agencies and say, look, you know, with the data that you guys have, show it to them and say, what's going on here? So community board is one door that, you know, it can bring more awareness and we can talk to the agencies. But you have your elected officials who, you know, they work for you. And, you know, city council deals with city, they have some city agency that can help with that. But the state is the one that gives the liquor license. And you have your state representative who you can reach out to also and make sure that you hold them to the fire if you have an issue that is impacting you.
Right. It's very difficult though.
But it can be done. You know, many communities, they do take the whole noise situation very serious. We are taking it serious too. But it takes time for it to get resolved. But you know, let's Laquita, let's reach out to Humberto so we can try to get a meeting with him and these folks. See what can his agency do.
And who knows how to reach the people in the building? Totals, can you put some contact numbers in the chats or email to?
Yeah, I
to
can
us
give
so
you
that-
an email.
Okay,
Absolutely.
okay, so we know how to, if we're gonna set up something, we need to know how to reach you guys, because in the interim, if we could have a good meeting with Humberto and perhaps the owners of Picante, and I'm not sure about the billiards people, I don't know them, but it seems like Picante is a good neighbor until 11 o'clock at night.
10-ish, yeah, about 10-ish, 10 to 1, 10 to 2, give or take. They kind of get a little loud.
And
Billiards is the worst though. Billiards is the worst one, and they are the ones with the
Yeah,
worst
that's,
noise
I
violation.
don't know, do you have a contact name? Someone has, but I'm just wondering if you do have an owner name or contact.
I do have an owner name. I don't know how to reach this guy, but I do have an owner
But a
name. in the
name would
LLC.
help, okay. And if,
Ariel
what-
Familia.
can you just email
Yeah.
that? Okay.
I put that in the
Oh, I
chat.
see it now. I see it now. That's the actual
You-
name of one of the
owner.
owners. Okay,
Exactly. So you have my email address, and then you have the name of one of the owners.
okay.
and I would like to say that the community board, because of this noise issue that has been coming up over and over, we have created a new form that when folks are requesting a liquor license, that, you know, this is a 17-page form that, you know, we would like for them to fill out and to make sure that, you know, these issues with noise, they will be addressed in the front with them, and for them to, you know, to be aware that we're paying attention to this.
All right, so stay tuned. Hopefully within a few days. Well, I know that Edwin has had success in at least talking by email to Umberto, and he has shown up. So let's just see what next steps we can bring about.
Yeah. And here, and you know, this is a new form that Community Board 9 has. You know, this is something that we are going to be requesting from these businesses to make sure that we address not only the noise, but also safety issue that has come up recently with the electric batteries, and if they will have it in their business and where will they store it. So CB9 is paying more attention to these things when it comes to you know, the complaints that we have received.
Thank you. So I guess I don't know if there's any update on the auto body shop other than.
And that was supposed to be Umberto too, from DEP. He needed to give us an update on that.
Okay, I know that's the one I believe where we have an incomplete resolution.
Yeah.
One is written, but there was a group meeting held with sanitation and environment and the community. And Yutha had some information that she emailed, but I do believe it's incomplete. You followed up with Umberto since then, and so there is this next step. Let's see where that goes over the next few days. We have a lot of work ahead. So far, so good on the nauseous building fumes at Miriam's building. It seems as if when they change, some kind of seasonal changes when this fume comes up, like, but I think there still should be something that's done there. Again, that's Umberto. Something should be available for amelioration even at that point. So we have Umberto on a lot. He has forwarded us to other agencies. We're trying to prevent some of this runaround that it seems like we're getting, but we have been following up.
Laquita, can I make a comment?
Yes, Bailey.
Yes, Bailey.
Just so everybody's aware, regarding those noxious, excuse me, smells, whenever it rains, the Riverbank State Park or the sewage treatment plant cannot process all of that. It processes about 300,000 gallons of water, of sewage per episode. You know, we had torrential rains in New York. So what happens is those pipes get clogged and it's not able to process it all the way through it. Because I talked to the guy that works there and he says that it backs up sometimes, and sometimes they have to, what they do is open up the lines to let all of that backed up things flush out. And that's when you get those smells a lot of times. So when there's torrential rains or extreme heat, that's when you're going to really smell it coming into the area. Now, I don't know if it's directly in her block, but I know that's a lot of that's coming from the sewage treatment plant.
Wow. They need to actually say that to us, to thank you, Bailey, for that information. And of course, like you said, we don't know how much of that is affected by her block, but that's why years ago, there was such a protest against the sewage plants being installed there because of the problems that they foresaw happening. And then the other problem is that we just don't get the response that we should get from the agencies that, you know, are charged with taking care of that.
Because if you look at the streets around the city over the weekend, whether you're in Queens, Brooklyn, Bronx, there's just flooding. It's just not enough ability to process that, which is just the sewer itself. And then now we're taking in raw sewage to be able to pump all of that stuff out there. So it's a lot. I'm not excusing anything. It's definitely not, you know, but that's one of the problems of having a sewage treatment plant in the community.
Yeah. I understand even more now why Ann Rocker and all of the people back in the day, you know, warned us and really fought against that. And I think that's even with the repairs or some renovation that was done. We need to revisit that, but there was some renovation that was done in the park a couple of years ago, and Umberto came to our committee raving about it, but it shows that there's still a problem. And if that is the issue, Lewis, I should say Bailey, I'm sorry.
That's
If
okay.
that is the issue, Bailey, then we need to make them aware that we are aware that there's still a problem, and whatever renovation they're proud of, great, but there needs to be more. They got to keep their eyes on the ball and just see what the next step is to be done. Or else we're all gonna, we'll be hurt. That's another way of our community being hurt health-wise, environmental hazards.
Yeah, I mean, we have one of the highest asthma rate in the community. So, yeah.
And I'm concerned about our lungs. I don't know what the statistics are on that.
I have a comment.
Patricia?
And I think that we have to do that. Look at, what could be alleviated, but looking at climate change, we had so much rain over this weekend, which is great, but it was like a heavy downpour. But also, we're expecting to have a really hot summer. So we already know this situation, this is how it's looking. So what are the city agencies doing to prepare for extreme weather? If we are already experiencing high rates of asthma and, the climate is changing, what are the agencies doing? How are they preparing?
Good point to bring up again. Very. Bailey, is there any information? I know you guys did a focus group a year and a half or so ago, because I participated, but I don't remember the feedback because I haven't been able to attend all the membership meetings. Is there any feedback that you can bring to us next committee meeting, or something that you could email that we could get out at least to, I could probably get out to about 80 or 90 people that I emailed to with this committee, so we can know in advance and we can get information out in conjunction, in partnership with others in terms of this climate change and how we should be preparing in the city. Very good point. And I know you guys were focused on it.
We did a focus group, and we also issued a report. I can give you the report. I just got to pull it off the website. But
how big is it? Is it something that, like, say, if we were notifying the community, do you have some kind of like a 2-pager or something condensed, or a flyer where they could, with the QR code or something that they could go to? But those who don't have that, a phone number where they can listen to a message in preparation?
I gotta look on the website. That's what I was getting ready to do right now. Until you brought it up, I was gonna go to the website to look at the report. But I don't think there's a 1-pager, but I can request one and send it to you and Dr. Torres, and then you can send it out. But we issued recommendations to the city of how to address, because we know cooling centers, they keep moving around, and all the things related to heat in the summer come up. And it's the same issues again. Either they move them, or some of they didn't open when they said they would open, or they opened and it just, because there was no air conditioning, people couldn't go there. So there was a lot of things we recommended about updating the website in real time to say, hey, the one on 135th and Broadway will not be open today, rather than me going over there at 9 o'clock tomorrow morning to find out it's not open. So we wanted them to make sure they update the website to let people know if they went on there to find out like where cooling centers is and other stuff like that. But I can get you the report.
I had talked to Edward, and our committee needs to put in a suggestion for a town hall. I'm wondering if we want to do something on the environment, and we can have these other kind of components that I talked to Edwin, Lewis, and Boschner about. They can still be part of that, but perhaps that big town hall should be on preparing for the summer. And maybe it could be something like, are you prepared for this summer? Something, and maybe for June. The problem has been location. But maybe it could be done at City College. We were hoping for Columbia, the Forum, but the office hasn't gotten back to me on the other dates that I put out there. But Lewis, why don't we try to do that maybe in partnership with We Act, because you guys have done the study, and then also who is our city person with the environment as well? Umberto would be one. Who
I
else?
think DOH also.
So if you, as the committee, I just think that that's where we could put the some funding there and just have a session. Would a Saturday work
It would, yeah. And
best for this kind of thing?
I will also say that maybe sanitation, because they deal with a lot of the sewers situation. Saturday, it works.
Okay, yeah, see, Patricia, I'm so glad you brought that up, because we were talking about something with the environment, but I was angling kind of around that, but that is present. That is something very present and imminent. So, and it seems like it's something we should try to do in June. So if Bailey, you have a couple of people who could speak on it or talk about the focus, the findings of the focus group and give direction, as well as people from the city. And at least for our district, anybody can come, but for our district. And maybe we could do that. We'll pick a Saturday in June. I kind of wish we, were able to have done it in May at this point, but June will still be good.
Yeah. Because the real
how does the
extreme
committee
heat won't hit until like June, late June, early July. So I think we got time to pull it off.
Okay. How does everyone else, let's see, Monica and Heather, does that sound good to you for our town hall, putting something together related to that? Because Edwin, Patricia, and I have, we're on the committee here and we like it. Do you guys like it too, that idea for just putting in to do a town hall on that?
Yes, that's fine. That's fine, Laquita.
Okay, thanks, Monica. Heather said, oh, Heather, the Saturday does not work for you. None of the Saturdays, anytime, half a Saturday, or we'll try to work
Generally,
it out.
no. But remember, there's the mayor's office for climate and environment, and I'm putting the link in the chat now.
Okay. And we'll talk about it. Maybe there's a Saturday where you can, it could work for you too, because I can see Parks and Recreation and Landmarks being a part of this, committee, jointly doing it. So we'll try to work that out. Okay. Let's see, the next item. I don't know if Odette is here or someone from the 5G, but apparently there's a lot of update on this 5G situation and meeting with the mayor coming up. Oh, there's Odette.
Yes,
Okay.
hi.
Let's see, before we go on, Odette, I'm sorry, hold on. Edwin, just on the noise and air, are you okay with is there anything else in the noxious fumes? Anything else? We just have to get Umberto
I think
on the
that
line.
the guys from Todos, they said that Sarah Williams is here.
Yeah, but I don't know if she's gonna say anything different than the is she? Sarah, can we come back to you?
Okay.
I'll be quick. I'll be quick.
Okay, please.
I just want to express my issue on 139th, West 139th and Broadway. There's a billiards and there is a restaurant called Picante that is playing music very loudly and is disrupting the residents that are living above the building.
Okay,
we put in
Todos, Michael, just
we keep putting in 311 requests, and when you put in the request, they'll close it immediately. They'll say they sent in somebody and they haven't sent anybody, or they will randomly one time send somebody and they will do absolutely nothing about the noise.
Okay, we just discussed that. There's a game plan already. So Michael did a pretty thorough job, and we all remember the general board meeting. So
Yeah, after that meeting, nothing had changed, and they recently were blasting music all weekend again.
that's what Michael had said. Yes, or totals. He's under the name. I thought I heard Michael, but totals. Okay. So we got you, Sarah. We're trying to do the best we can. And Michael presented some new information as well. But if there's additional, just hold on. If there's anything that has not been said that you think of, let's come back to you. Okay, give us a few minutes here. Okay. Okay, Odette, on the 5G, if you could be brief and
Yes,
at the same
absolutely.
time informative. I know a lot's going on.
Yeah, thank you so much for having us again. Yes, we have been invited to speak to the mayor. That is on May 17th. It's going to be at noon, and it's going to be on Wednesday. We only have a half hour with the mayor, but we are going to have a wide cross-section of people around the city, different chairs of various community boards, as well as other people. Now, and we're going to be strategizing about that. So we do have a couple of weeks to do that. And we'll be reviewing that on the Tuesday meeting. I usually have a Tuesday meeting with a cross-section of people around the city. And I believe you're invited. You're a standing invitee, Lakita.
Yes. Did you send to Barry Weinberg also?
I don't have his email.
I'll send you that, so that since you're sending to chairs. Okay.
Okay, fantastic. Now we've been going from community board to community board and talking about what's going on, and there are now 14 community boards that are on board for disapproval of the 5G towers or moratorium.
Okay, and we, just so the committee remembers, we have a resolution that we voted on, committee and general board, against the particular 5G tower situation in our area, in our district. Okay, go ahead.
Can I clarify something, Akira? So what we wanted to do is to hold off on until we get more clarity on the issues that were brought up by Odette and her team, but not against it, but just trying to get more clarity on this issue.
Right. The resolution went forward, but
yes,
we did have, we wanted more information. I think that's what, do you have that additional information, Odette, that if you remember?
Well, the additional information is information that OTI is supposed to be providing you with. I mean, the information is still the same, that it is dangerous. Because the thing is that what OTI is doing is they're not providing transparency on all of the information. And actually now there is a letter that the Federal Communications Commission sent to City Bridge, which I don't know if you're aware of. They sent us, oh my God, that's a big news. The Federal Communications Commission notified City Bridge that it was basically in violation of 2 federal laws, and they should not have started construction at all prior to environmental review and historic preservation review. So they basically are in violation of the National Historical Preservation Act and the National Environmental Policy Act, because they did not engage in any review, and it has to be done for every single tower.
Odette, if you can just give briefly an overview of what we're talking about, because we have some new folks who are in the meeting and probably are not aware of what we're talking about with the 5G and what the city and the towers.
Yeah, sure. Your district is slated to get a number of cell towers. There are 59 community boards, and each community board is getting a certain number of cell towers, depending on whether they're considered an equity district, where they're getting a lot of towers, or not an equity district, where they're getting much fewer towers. So for instance, I live in Queens. In Jamaica, they're supposed to be getting the second highest number of cell towers, which is 104 cell towers on the streets. Staten Island Community Board 1 is supposed to be getting the highest, which is 117. In your district, it's not as many, it's a lot fewer, but it goes from district to district.
I think
And-
there were 5, all of them around Columbia University.
Yeah, they were right up, I believe that was Amsterdam Avenue, right
Broadway.
across the street from St. John the Divine, near VNTs and, all the way up Columbia University. So, but they keep changing the goalposts because they're taking off the list on the data set the towers that they've installed, and they're keeping on the ones that they're proposing that have not yet been installed. So we don't have a complete list. And I have no idea where to find it. And I've already foiled for a complete list of everything that's been installed and everything that's been proposed. Because now we only have a list of what's been proposed, but not what's been installed. So in my district in Queens, they've already installed 2 and they weren't on the list. And I had no idea when I went to my community board to talk. So, the 5G towers really pose a number of issues with respect to, first of all, the environmental review that was done on the towers was insufficient because the premise indicating that there was no environmental impact was that 5G was not going to use a substantial amount of energy. That is incorrect. It is known by the industry that 5G consumes an exorbitant amount of energy. So if we're trying to reduce our carbon footprint, and you're in the environment committee, you're part of the environment committee, you would be interested in this. This is something that should have been factored in, that 5G runs very hot because there's a lot of analog and digital conversions. And there's a number of other issues, the public safety issue, they're too close. They want to put them too close to the homes and the schools. And what if there's a structural failure and then it crashes into somebody's home, it crashes onto people on the street, it crashes onto children in the schools? That doesn't make any sense. So the whole thing we really need to take a step back. And Borough President Mark Levine said that to the mayor. He said, we really need to take a step back. We have to slow down the process because there are a lot of unanswered questions. But it's becoming more and more clear that City Bridge has basically violated federal law. So, and the FCC has not precluded, did not preclude taking enforcement actions against City Bridge. Now, it seems that what City Bridge is going to need to do is they're going to have to do a review of every single tower and every single antenna in the tower. And they have to do a post-construction review. So it's a little bit of a mess right now for City Bridge, but it gives us a reprieve in order for us to get more information about this. But the more that we look into it, the worse it, the worse information, the worse it gets. Now, tomorrow we are going to have on the Tuesday meeting a specialist in Section 106 National Historical Preservation Review, which is exactly what is happening now with the City Bridge Link 5G kiosks, cell towers. And he's going to talk to us about the success that he has had in Maryland, in Tacoma Park, Maryland, where they found a positive environmental declaration against Verizon. This is a first for Verizon, apparently. And we really want to, see what is involved in the historical preservation and see what needs to be done. But City Bridge has not done what they kept saying that they did not have to comply with federal law. Well, the FCC didn't agree with that. And then we're also going to be scheduling a series of town halls. And we already have a number of very prominent people who will be speaking with us. A very prominent scientist in the wireless radiation area, a medical doctor who treats people in the wireless radiation area, Kent Chamberlain, who I believe you've already heard from. And he's computer engineer, he is an engineer and a professor at the University of New Hampshire. He was the former New Hampshire commissioner, where the New Hampshire Commission found harm with respect to wireless radiation below the FCC limits. We also have Theodore Scorato, who will be speaking from the scientific think tank Environmental Health Trust, and Gary Bolton so far, who is the president of the Fiber Broadband Association. It's the largest fiber broadband association in the country. So we're putting together a lineup, and we're hoping that community boards will come and co-sponsor the lineup so that we can actually get some information out to the public, to the general public about what's going on.
Can you put the link in the chat as it relates to the historic preservation issue that you just mentioned against Verizon?
Oh, yeah, that one was in Maryland. I can certainly give
In
you.
Maryland, yeah.
Yeah, I can
Can you-
definitely give you that information. And the gentleman, the specialist who was actually working on that case and who won it, is going to be speaking with us tomorrow at our Tuesday meeting.
Odette,
Is your meeting open to the public?
Well, it's if it's open to community board members who would like to come, and specific people in the public who have shown interest. And if you'd like, I can certainly give you the invite. I just sent out the invite.
Okay, I'm co-chair of the Landmarks Preservation and Parks Committee for CB9. That's why I'm asking.
Oh, fantastic. Well, you're
Okay.
you're really going to want to know about this one.
Yes.
That would be great. And this is, if Heather can make it, and one or two others of us can, that would be great. Which meeting is this, Odette?
It's a standing meeting that we have
Tomorrow.
I'll put my email in the chat for you, Odette, if you could just please reach out to me.
Yeah, sure. Absolutely. I'd be happy to do that, Heather. And it's just
a meeting tomorrow. It's every Tuesday until.
It's every Tuesday from 2 to 3. And we talk about strategy. We talk about, different things that are happening in the city, what we need to do. And so it's a strategy session for people in the city.
Good evening, Odette. This is Bailey from WEAC. Can you I missed one thing. You said they were in violation of two things. One was the environmental review, and what was the other thing?
It was the National Historical Preservation Act.
Okay, thank you. Thank
That
you.
will fall on the landmark. And I would like to remind everyone that this is something that we have seen throughout history, where we have pollution taking place and you have big companies lying to us about the data and hiding the data. I put the link as to what took place with oil and what recently, happened in the Supreme Court that said, each state can now go after you with the damage that you have done. So, we want technology, we want progress, but at the same time, we want to make sure that the most vulnerable and that the people are not harmed. So this is what this effort is for, and I encourage you all to attend this town hall, educate yourself, ask questions, because later on is that when we find out the damage that this can cause to us or to the environment. So thank you, Odette, for your advocacy, because if you didn't bring this up to our attention, I probably would have had one right next to my apartment.
Yeah, thank you.
Right.
I'm also a technology attorney. I've been a technology attorney for 20 years. So I work in technology. I went into technology because I thought it was a great thing because it helps people, right?
Yes.
But then you have to draw the line when you see that it's now on the verge of hurting people. So that's where I draw the line as an attorney and as a human being.
Yes.
Once that happens, that's the line in the sand for me as a technology attorney.
There's one of the senior executives at Google who is resigning or has quit for one of the same reasons. Thought it was something great, and then he saw the damage that was being done.
Yes, exactly. And so
I got to read up on that a little more.
Exactly. And because I am in the know and I know a lot about technology and I do a lot of due diligence, when I started doing my due diligence, I thought, okay, this has to stop because we're not being told all the information.
Which is what happened with the oil companies when they knew about the CO2 and what it costs to the environment, but they fought it and hid it from us. And now we are where we are with the damage that we have caused to our environment. So this is another, thing that is in its infancy in our community, and we want to make sure that it's done correctly.
Mm-hmm.
Yeah.
Yes, it's basically straight out of the tobacco playbook.
Yes, it's sort of the tobacco playbook. Who copy it from the oils also. Yeah.
Mm-hmm.
Okie dokie. Anyone has any questions?
Well, Edwin, do you feel that there's anything more? I think you talked about the pollution on commercial trucks, and we have
No,
follow-up. It seems like so much depends right now on our follow-up with Umberto,
it would have been
sanitation.
nice if you would have been here. Yeah.
And we may have to schedule a special meeting, but it would be great if they could be here at our June meeting, but we got to get this covered, so they can't avoid us. We just got to get this done.
Yeah.
Odette, thank you very, very much.
Thank
And
you.
we'll try to, Heather some others left their information for you in the chat, okay?
I'm looking.
And if you want to email something for me for distribution to our committee and board, I will do that.
Okay.
Odette, and
Now,
I send you Barry's email.
Yes, I saw that. I'm writing that down right
Yeah, for the community board.
Okay.
And for the mayor on May 17th, that's what I'm thinking.
Okay.
Okay. And probably he and Victor should, in addition to our committee, those two, Victor Edwards also. You have his handy.
I don't have,
that Edward might, I think he's looking.
I'll send you Victor's also.
Okay.
Okay. So we'll be covered with the talk with at least having a presence with the mayor on May 17th. Okay, so I don't think Carlton has an additional update. He was going to bring something related to our attention, related to some water issue he heard about that in the Hudson River, something that was going to be done that a lot of people should be in opposition to with the Hudson River.
I know what he's talking about. They were going to do from the old nuclear plant, they were going to discharge some of the water. It's like some of the vapors off of this nuclear plant somewhere up the Hudson. I can't think of the exact word, but they're decommissioning it, but there's still water in those tanks. They want to just let that water go into the Hudson River. I think that's what he's talking about.
Oh my God.
It was in the news we're now in May, so it's definitely like.
He brought it up a couple of weeks. It was about 3 weeks ago that he brought it up.
Yeah.
He said he had and he was flabbergasted, and I thought he was going to come to our committee meeting in April to discuss it, but anyway, he wasn't there.
It's
so
Indian Point.
Yes.
Indian Point, Bailey.
Yeah. And they're going to be dumping, or they were in the process of dumping water and vapors in the is wastewater.
I mean, what can we do? What is WEAC stand on that, or do they have a stand yet?
They made a statement, but I mean, a statement is, we can't just go up there and block it and tell them not to do it. So I know they issued a statement on it, but as far as that, I haven't heard anything from the team about it.
Can you get us some information? When is this all supposed to happen? Or proposed to happen? Do you know?
I'm getting ready to put the link in the chat to the article, so I'm gonna look at it right quick.
I tell you, we have to just.
I also put a link in the chat, Bailey. I don't know if that's the same one you have.
This is one I got from the Gothamist. So, I mean, there were a couple of the Gothamists had it. AM New York had it. There were a couple of them in there.
I'm gonna take a picture of this. Well, I'll tell you what, there's so much going on, and regardless of what DeSantis says, we have to stay woke.
Yeah.
Stay woke. And this is I mean there's just one thing after the other.
And
So
it's
there
supposed to
must
be
be, I'm,
18,000
and you
gallons.
can't rely on people to have your benefit at heart. You know, maybe it's the only thing they can do. Maybe there's no other alternative. We don't know, because we can't trust some people, particularly corporations, because they'll do things to hurt another group. But you know, as long as they stay out of their neighborhood, you know.
Right, but they can't use, you know, poor Black and brown communities as a dumper ground. We're talking 18,000
Exactly.
gallons, 18,000 gallons of this wastewater.
But
So if it
we
comes
may
down,
have to have bodies. You know, I don't know if any protests are organized. We may have to have bodies standing out there.
What are, we haven't heard our electeds. They came before the community board general meeting, the representative. They talk about all the great things that they're doing. Here you have something that will have a direct impact on the community health, and nobody's giving us an update on this. Where is the assembly, our senators? We have to get them so they can go and ask DEP to come back and, you know, give us an update and how this is going to impact us.
And is there a committee? I know there's a committee on health. Is there a committee on climate, environment, sanitation?
I believe there's a committee on environment.
We don't know who chairs that with city council.
Oh, this is the, I think this will be the, well, the city council will also play a part, but this, I think this is the state.
Yeah, but okay. So the state should have a among their representatives.
Oh, yes.
Representatives, assemblymen heading up. We could find out from Robert Jackson.
Yeah, like DEC, the Department of Environmental Control.
I don't think Robert Jackson.
Again,
the Department of Environmental Control, DEC, that's the state agency. Right,
but who's the our elected representative?
It would be our state assembly person, and is Cordell Clear also our state senator or state?
She is, but usually the assembly has committees. You know, they all have committees that do investigations and all of that.
Yes, but yeah, but I guess we would start with our state person representative, our state assembly person, and our state senator.
Al Taylor.
Yes, yeah, Al Taylor is our state assembly person. And Cordell Clear, I guess, is our state senator.
Well, Al is supposed to speak at our candidates forum on May 13th. We can ask them there.
Okay, is that on a that's always a Saturday?
Yes, May 13th is the day before Mother's Day. I know but usually we always have it the second Saturday of every month, but we're going to bring the elected officials in the area to call them out and say, hey, let's talk about this issue. So I'm going to already flag that question for him.
I know you'll email something on that so that we get it, because the community board usually gets it. I'm a member, so I usually get that. All right, so Bailey, you're going to look for any update to see when they are proposing to start this.
But they're pushing it back. Somebody just put it in there. It's supposed to be pushed back. The plan's been moved to September. Somebody just put it in the chat. I was going to put the same thing in the chat as well.
Do you know who was helpful in pushing that back to September? That would be a.
I don't know.
Because that could be a good contact person, and they may already have some things lined up for protest. Who knows? Okay, so that's. Can you be our link, Bailey, with that any information further on that, and you know the that Hudson River project, the nuclear plant project? Okay, we have our hands full with follow-up.
But again, it always occurs in our community. I mean, we talk
Yes,
about 5G, we're talking about the bus depots, we're talking about asthma. It's always in our community, and we gotta just like, hey, we gotta shut the city down. We gotta let them know, not here, not anymore.
yeah, that's what I'm saying. We may have, oh goodness. Okay. That's some new business that has come up with all of our updates and the feedback. And that's why this segment, we'll just keep updates as part of our agenda. That helps feed in new business, old business as well. So in between this meeting and our executive committee meets next Thursday. So if there's any information that the committee should have and know, if anyone wants to get it to me and Edwin, I can make sure and just state that you want it forwarded. Most of the time I forward it right away. I can do that.
So Laquita, I just put it in the chat there. If anybody wants to come, May 13th, I know it's a day before Mother's Day. We're doing a candidate forum. We reached out to Al Taylor, Christian Richardson Jordan, Inez Dickens, Yusef Salam. We want them to come and we're going to confront them, especially Al, about this Hudson River stuff. We got to confront them.
Yes, yes.
Because we're us 50C3, 501c4, so we can endorse candidates. So
okay,
we can hold them to the fire.
And if you send me what I will do, there's about 82 people that are part of the mailing for this committee, people who have presented to us before and all. I can, if there's a flyer, I can do one email that touches on issues that we need to get out to people who are linked up with us.
Okay,
So
the only thing we're
Odette's
just waiting for
information.
is we're going to try to switch it. Instead of doing it at 155th, we want to do it at the school, which is right next to WEAC's office. So we're just trying to confirm that, and then we'll have the flyer.
Okay. Okay, fantastic. Any questions, any other comments, questions, statements, anybody? Who is JMac? Providing some interesting, good information in the chat. Do you know them, Odette? Because I think it's kind of.
Yes, JMac is Jill McManus. She heads up New Yorkers for Wiretech.
Say that again, Jill
It's Jill
McManus?
McManus. It's Jill McManus. She heads up New Yorkers for Wiretech. She has some problems though, because she can't go from her computer. She has to go through her telephone, but I see her telephone is not on the screen, so she may not be able to talk.
Okay, but I am taking a screenshot of some of her links and all, and so we can refer to them.
Well, you can also save the chat, right? You can save the chat.
The chat, yes.
Yeah, you can save the chat.
Oh, I just did a screenshot with the chat information. Because sometimes we turn the recording off and I haven't pulled up the information I need, so I just do a screenshot so I make sure I have it. Now, Sarah, is there something, Michael covered a lot of information. He provided us with a lot. So I'm not sure if you'll have something that's different, but there was a follow-up, and the follow-up that we're going to do, Michael mentioned that that DEP had filed complaints against the two places, particularly billboards. They are listed. Edwin's going to follow up with those in terms of his resolution and some other action. And it's not going to be overnight, as he has stated, and others, but it's going to be right away. We'll continue this urgent work on trying to, just calm down the noise pollution, the noise concern. The fire department.
And, one thing that, that place has gotten 3 summons, but by having a meeting with DEP, they can, come there and monitor it more frequently. And summons, they can be a deterrent to folks. Maybe 3 are not enough, but if they start to add up, then at some point, folks, they see that it's not cost effective. But those summons are very expensive for noise. They can go up to, I think it's $5,000 or $10,000.
Wow.
Yeah.
That'll teach them. Yeah, that could almost be immediate. When I say immediate, within several weeks, as long as he meets with us. Now he puts out the summons. Who acts on the summons?
That is a good question for the EP. Yeah.
Mm-hmm.
And we invited them to come. We sent them an email last week. And we're gonna have to follow up to see why they were not here.
He has responded to you, but at least he's open to the rapport. So we just got to get him to coordinate the people, everybody involved.
Mm-hmm.
All right. Any other business? Was that Heather? Was there someone else who had a statement?
No, I would just like to point out to todos nosotros and Sarah Williams that do people have recordings of how the apartments vibrate?
Yes.
Recordings of all of that, and for how long? Because I just learned about it, was it 2 weeks ago, a week ago, that we had a general board meeting. And as you see, things take a long time. And we had one of our board members, she was complaining about fumes. And she has been documenting this for like over, I think, 10 years, right?
Yes, yes.
So it's just, documentation matters, and please just be patient. It's a fight. And, something that we also have to point out, if something like this were to be happening in the Upper East Side, it would not be happening, so.
And I will tell you guys
and Michael has said Sarah has videos of noise. Which
and
has the sound that records the sound. Hold on to them, and hopefully those are dated.
And it's like I don't know if you remember, Laquita, we had one time Scott Stringer. He was the controller for New York City.
Right.
He came to the community board and he talked about the power of 311. And he said that if in Brooklyn there is an issue, but I think he gave the example of a light, but of a street light that works, but it needs to get fixed. And then you have one in Harlem that it really needs repair. If the one in Brooklyn gets 400 or 500 calls, and the one in Harlem only gets 30 calls, he said, guess which one is going to get fixed?
The one in Brooklyn.
The one in Brooklyn. So, those 311 complaints that you guys are getting closed right after, that is the finger in the pulse as to what's happening. It doesn't matter if the police close them the minute you submit them. Nobody's going to sit in their apartment submitting hundreds of complaints in a week for an issue that doesn't exist. So continue to put them in, and maybe even getting the media involved, because once the media gets involved, everybody's going to start moving. And the only documentation that we have outside of our testimonies, it is that documentation that is coming from you guys on the ground. Yeah.
So keep those 311 calls going in.
So shall we call the meeting?
So can I have a motion to adjourn the meeting? It is now 9:14 p.m.
I first move motion.
Yeah.
I'll second.
Was that Patricia?
Yes.
That
I'll
was
second.
Patricia Ramos moved.
Yes.
And Edwin Torres has second to adjourn the meeting. Thank you for everyone who attended and participated. And we look forward to having some hefty, substantive feedback at our June 5th meeting. Thank you. Thank you.
All right, thank you all for joining.
All right, take
Good
care.
night.
Thank you.
Good
Good night.
night.
Good night.
All right, Laquita, so shall we stop the recording?
Yes.
Stop the recording. Do you want to
Okay.
stop the